Hello and Assalamu alaikum. Ultra Scan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is has not been mentioned to us, but we're going to take you through the entire CBCT. On the panoramic view, you can see the two implants placed on the lower right hand side, and these implants seem to be doing very well. This is the transaxial view, which is basically the proximal view. And on the proximal view, you can very clearly see that the implants are placed center of the ridge. There's good bone support on the lingual side with relatively better bone support, with relatively okay bone support on the buccal hand side. This is the mesial implant. This is the distal implant placed in the center of the ridge again. Good bone support on the lingual aspect and slight less bone support on the buccal aspect. Moving to the upper right first premolar region. This is the upper right first premolar. The implant here does not seem to be very well placed in the center of the ridge. We've got half of the implant seems to be outside of the ridge, which is not supported by bone on the buccal aspect of the implant. Whereas if you look at the axial view here, you can very clearly see that the implant is placed on the this is where the lingual plate is, and this is where the plate dips down. There we go. We're going to zoom in, and here the plate gets very narrow. And on the transaxial view also, it was clearly visible that as we move from the second premolar anteriorly, the bone thins out, and then we replaced the implant is present, and then the bone thins out further, and then it starts to thicken out on the mesial aspect where the canine is present. So this is another thing that we wanted the doctor to see. Moving to the upper left hand side, this is the upper left canine, and now we move into the first premolar region. So here the ridge is quite significantly thin. We've got a 3.6 mm of ridge width. We've got approximately 5.1 at the center of the ridge, and we've got approximately 12.8 millimeters of ridge height. I'm going to take you slightly back now. Now this is the first molar region. Sorry, this is the second premolar region. Here the ridge is quite significantly thin, as you can see. This is the first molar region. Here we can see that again the ridge is quite significantly thin. We've got just 4.9 mm of ridge width with approximately 4.4 mm of ridge height. We've got immense sinusitis present here in the upper left sinus as well. So sinus lift procedure needs to be done once the sinuses are clear. This is the first molar region again. We've got BDRs with root canal treated. We've got 8.7 mm of ridge width with approximately 5.9 mm of ridge height. But the thing to note is that there is perforation of the cortical plate, which can lead to odontogenic sinusitis. This is the region of the second premolar. Again, sinusitis can be seen. We've got ridge width of 10.6 with approximately ridge height of just 3 millimeters. Now moving to the region of the 8. The 8 is very well supported by bone. No radiolucency or major cavitation, but we do see an enamel lesion of caries or radiolucency or a hypodense area. So if there are any further questions regarding this case, please feel free to reach to our team. This is the axial view where you can see the right hand side, and now this is the left hand side. And on the left hand side, it is very clearly visible that at the crest of the ridge is quite significantly thin. As we move down, the ridge does get a little thicker, but not significant enough to house decent dental implants. On this view, you will be able to see that the sinus on the right hand side has sinusitis initially, but as we move towards the left hand side also has sinusitis. So both the sinuses have maxillary sinuses are quite significantly filled. We can also see a radio opaque material which could be part of the endodontic material which is dislodged into the sinus, which is visible right here in the left sinus. So if there are any further questions, please feel free to reach to our team. Thank you very much.